This is the Transition Series Topics for the EMT, Topic 3, Legal Issues in EMS. Our objectives are to discuss legal terms commonly associated with EMS laws and regulations, to understand patient rights as applied to emergency and health care, and to identify the EMT's role in organ donation and other special reporting situations. Legal issues are a part of every patient contact. They are integrated into every call to which we respond. They provide a legal framework for emergency care and serve to protect those who provide and those who receive the care. Laws serve as that framework. Failure to adhere to the legislation that we operate within can result in consequences. For example, an EMT may be sued for a good reason, for a bad reason, or for literally no reason at all. The way we protect ourselves against lawsuits, whether serious or frivolous, is to follow the state framework for EMS, always behave ethically, maintain the standard of care, and always properly complete documentation. Documentation is our strongest tool, our strongest protection. It's important to be familiar with the laws pertaining to EMS in our state. There are certain concepts that always arise at one point or another in an EMS lawsuit, such as the scope of practice, the duty to act, statute of limitations, ethical behavior, medical direction, negligence, intentional torts, and Good Samaritan laws. EMTs may be required to testify in court in a variety of legal settings. Often we're called upon to give depositions about what we've seen on an ambulance call or in an emergency response under oath. Every patient that summons EMS has certain rights. They include the right to be treated with respect, to get the best care that we as providers can deliver for them, and to protect them to the best of our ability. They have the right to provide advance directives for their care should they become incapacitated. They have the right to specify that they wish to be an organ donor. They have the right to be transported if they reasonably would expect it but cannot ask for it. They have the right to be transported if they ask for it. And they have the right to refuse transport if they are competent and do not wish to be taken. They have the right to confidentiality. We should not discuss our patients in a manner that would allow them to be identified by someone else not connected to the case. We are required as EMT providers to report certain types of conditions. Mandatory reports vary from state to state. We should remain abreast of what our state requires and learn the reporting systems that are being used. For example, we are required to report suspected abuse or neglect. We are required to report a potential crime. We are required to report a suspected infectious disease exposure. We're required to report any treatment of incapacitated patients, and we are required to report dog bites and other animal bites. These are just a few examples. It's important to know what is required in each individual state. So long as there is EMS, there will be laws governing EMS. Each of us is responsible for staying abreast of the laws that apply in our state. The best defense for preventing a lawsuit or for mitigating our exposure in a lawsuit is to provide conscientious care to the patient, follow the standard of care as defined in our protocols, follow the state guidelines, and especially to provide high quality documentation of the situation on the patient care report. It's important to use a standard format in your patient care reports, to follow that format every time to avoid accidentally omitting something important, and to write legibly when you're making a handwritten report.